The first step in getting the right treatment is to consult a psychiatrist. Your psychiatrist will perform a detailed clinical interview and also advise you lab tests to rule out other medical conditions that may be causing depression-like symptoms. In a lot of cases, simply reversing the medical causes alleviates your symptoms of depression. In addition to that, the psychiatrist will also explore your family history and along with that, environmental and cultural factors that may be leading to your condition. This helps the psychiatrist arrive at a diagnosis. Once diagnosed, depression can be treated through lifestyle changes, supplements, medications, psychotherapies, brain stimulation procedures, or a combination of these. As a general rule, combinations of therapies work better than single treatments. Let's look at them one by one. Numerous studies link traditional Mediterranean type and Japanese style diets with low risk of depression. Both of these eating patterns involve lots of fruits, nuts and vegetables, fish rather than meat, oils rather than solid fats, and moderate to minimal dairy consumption. Studies show that moderate intensity aerobic exercise such as brisk walking for 20 to 40 minutes 3 times a week for 6 weeks significantly alleviates the symptoms of depression, especially the physical symptoms including sleep disturbances. What's more, the effects of exercise are long-lasting. This is because exercise raises core body temperature, which in turn leads to feelings of relaxation and tension relief. In addition to this, exercise also causes the release of endorphins, which are neurochemicals that have a direct mood-boosting effect. But the most enduring effect of exercise is the release of nerve growth factors in the brain, causing stimulation of new nerve cells to form and also new connections to form between these new nerve cells, literally opening up new channels of acting and thinking. Also, a sustained lack of sunlight exposure dysregulates the production of hormones such as melatonin and serotonin that affects cognition. Sunlight exposure resets the body clock, maintains healthy blood flow to the brain, and also causes the production of vitamin D. Now, numerous studies suggest that vitamin D plays important roles in maintaining brain health, stimulating the growth of nerve cells to preserve mood and memory. Let's talk about supplements now. The first one is B vitamins. Now, all B vitamins are crucial for maintaining brain health, but specifically B6, which is pyridoxine, B9, which is folate, and B12, which is cobalamin, are crucial for maintaining nerve cell health and nerve cell growth. This is because these three are cofactors or catalysts for enzymes that are involved in the production of brain chemicals that influence mood. Number 2 is the mineral magnesium. Magnesium reduces inflammation throughout the body, including the brain, and also stabilizes the levels of brain chemicals linked to depression. Number 3 is omega-3 fatty acids. Now, omega-3 fatty acids are also anti-inflammatory, that is, they reduce inflammation in the body and in the brain, but their main effect comes from their effects on the nerve cells. They prevent the nerve cells from degenerating and also reverse the damage that is caused to nerve cells from depression. Number 4 is S-adenosylmethionine. Now, this is a synthetic form of a natural compound found in the body. S-adenosylmethionine boosts the production of serotonin, which is a neurochemical predominantly involved in depression. Okay, let's now talk about antidepressant medication. In the brain, although electrical signals send messages from nerve cell to nerve cell, these signals are actually relayed by chemical signals found across the tiny gap between two nerve cells. This tiny gap between the nerve cells is called synapse. In the synapse are present the chemicals that form the chemical signals. Now, the antidepressant medications actually act on these chemicals. These chemicals include norepinephrine, serotonin, and dopamine. They're also called monoamines. Antidepressant medications may start to show improvement in your mood within the first week or two of starting, but the real effect is actually seen after 2 to 3 months of initiation of these medications. This is because it takes time for new nerve cells to form and the connections between these nerve cells to form as well. This is a process called neuroplasticity. Antidepressant medications are not sedative, they are not habit forming, and they usually do not stimulate the person taking them. Antidepressants can have side effects, but many of these side effects actually lessen over time. Talk to your psychiatrist if you're experiencing any side effects with the medications you're taking. Do not stop your medications without talking to your psychiatrist first. Psychiatrists will usually recommend you to take medications for 6 or more months after the symptoms have improved. For people who are at a very high risk of developing future episodes, long-term maintenance treatment with these antidepressants is recommended. Let's talk about psychotherapy now. Psychotherapy or talk therapy helps by teaching new ways of thinking and behaving and also changing the habits that may be contributing to depression. Psychotherapy helps people understand and work through difficult situations or relationships that may be either contributing to their depressive illness or may be causing depression in the first place. Also, psychotherapy helps you by teaching effective coping strategies that will help in relieving not only your current episode of depression, but also in preventing and managing any future ones. If you're going through a mild depressive episode, just psychotherapy should be enough. But if you have moderate to severe depression, psychotherapy will usually be paired with either medications or brain stimulation procedures for proper benefit and relief. Studies show that a minimum of 12 to 20 weekly sessions at a therapist's office are necessary to show any significant improvement in your symptoms. Now in the last segment, I'm going to discuss the brain stimulation therapies. Number 1 is cranial electrotherapy stimulation or CES. CES is a very simple treatment employing a small battery-powered device. The CES device sends pulses of very low amperage electricity, usually less than 1 milliampere, through thin wires to the electrodes that are clipped to your earlobes. The frequency of these pulses is 100 Hz. CES leads to the release of endorphins, norepinephrine and serotonin in the brain. Number 2 is audio-visual entrainment. AVE works by using rhythmic sound and flashing lights to alter the frequency of brainwaves. Now, since different frequencies of brainwaves are emitted during different states of mind, altering the frequency of the brainwaves to that of relaxation can be used for therapeutic benefit in depression. Number 3 is low-intensity transcranial pulsed electromagnetic field therapy. Now, this sounds really complicated, but it's not. LITP-EMF functions on the principle of electromagnetic field induction. Now, in this case, that induction is to the tune of 10 millitesla, which is very low. In very simple words, what we're doing is harnessing the power of magnets to induce an electrical current wherever it is applied. So when it's applied to the brain, it functions at the cellular level. It increases the cellular voltage, which helps recharge and rejuvenate the cells, and then also increases their nutrient intake. Essentially, once the cells are feeling better, the cells are functioning better, and also the hormones that have been imbalanced in depression become rebalanced. Number 4 is transcranial direct current stimulation. TDCS is a very simple procedure involving a device that sends a weak electrical current or a DC current to the tune of around 2 milliamperes to the scalp using a headset-like device. The main goal is to target and kickstart the circuit that is involved in depression. Number 5 is electroconvulsive therapy. ECT is a medical procedure commonly reserved for patients who have not responded to any other forms of treatment for depression and are highly suicidal. ECT is performed under general anesthesia, and a medical device sends electrical currents down the brain, causing a clinical seizure. One of the many mechanisms of ECT is the stimulation of nerve growth factors in the brain, which helps replace old bad circuits with new good ones. And lastly, number 6 is ketamine. Ketamine, long used as an anesthetic agent, is now also being used for depression. Infused intravenously very slowly over a period of 1 hour in carefully titrated doses, it is very fast acting, relieving symptoms within hours of an infusion. Ketamine infusion is so powerful that a single dose can have lasting effects up to 2 weeks. Ketamine infusion is widely used in emergency psychiatry, and that's because it rapidly reduces and reverses suicidal thinking. Ketamine increases the levels of brain-derived neurotrophic factor, and this causes formation of new connections between nerve cells, in a way resetting the brain to think more positively. A general course of ketamine infusion is twice weekly for a period of 6 weeks. Okay, so this brings me to the end of this video and the topic depression. I hope this series has brought some value to your life. If you or your loved one are suffering from depression, do not wait to consult a psychiatrist and discuss your best treatment option. Have a great day ahead.